Sheena Symington and I were having a discussion this morning. I decided to record a part of it, thinking that would be of interest to my followers. The topic is auricular chromotherapy. I think this therapy holds great potential. And if you're not already aware of what it is, or if you are a practitioner or know a practitioner who might be interested in adding these skills, you might want to listen to what follows. My conversation with Sheena Symington. Here we go. All right, my guest today is Sheena Symington. She is a research assistant, research associate with Dr. Magda Havas, and she is the director of the Electrosensitive Society. Welcome to the EMF Remedy Podcast.
Thanks, Keith. It's wonderful to be here.
It's good to see you again. Last time we talked, one of the subjects that we talked about was auricular chromotherapy. And I just found out recently that you are teaching not one, but two courses for therapists or doctors who would like to add this to their capabilities. Can you tell us about the courses?
Beautiful. That's what I suggest. People that are already dealing with stress, anxiety, and trauma with their patients, it's another tool for their toolbox. It's a profound, novel, simple technique. It's so accessible to people because they don't actually have to talk about the trauma at all. They don't have to talk about this difficult event that sometimes just grabs a hold of them and they don't know any other way to get rid of it or to set it down. And it's a simple, non-invasive 3-minute treatment that has amazing results.
I know it's almost beyond belief. The incredible metrics with regard to success with this, and with only a 3-minute treatment, sound unbelievable. And the fact that it's light-based is just amazing to think about. So if you could tell us a little bit more about it, and what are some of the character or the key questions that you get, and maybe some of the key concerns as well, if you could.
Sure. So Dr. Daniel Assis, he's a pain management specialist and anesthesiologist from Argentina. He developed this technique. He was very familiar with using EMDR, eye movement desensitization and reprocessing. When EMDR started to be used for trauma, it was thought as very woo-woo and didn't really realize how successful it would have been. It's much more readily accepted now, and there's a lot of research being done on it. And so Dr. Assis realized that using some of those same strategies or similar strategies, he used colored light on the acupuncture points of the ear. And those acupuncture points are associated with different parts of your brain that are, associated with the limbic system and your memory. So those are the trauma targets that the light actually uses for this 3-minute treatment.
And for people who might be wondering, what does all of this have to do with surviving this crazy electro plague that we're dealing with here in the 21st century? And for those people who have become sensitized to electromagnetic radiation or just EMF in general, very often people get stuck in a sympathetic, parasympathetic response cycle that's not productive. Do you want to say just a few words about that?
Yes, that fight, flight, or freeze component is very common, as you know, and people can physiologically be put into that by the exposure to electromagnetic radiation and electromagnetic fields and frequencies. And also they can be put in that fight and flight, like you're saying, from something emotional or traumatic. And it's that combination of looking at both the physiological response of the electromagnetic fields and practicing electromagnetic hygiene. So you're in a clean electromagnetic environment, so you're not physiologically put into fight and fight. And then once you do that, addressing any kind of emotional aspects to whether it's journey through EHS or electromagnetic radiation syndrome, or just like you say, living, especially through COVID. So many of the healthcare providers that I've trained since COVID have been using it with almost every patient that comes into their practice. And again, like I was saying, Keith, it's such a simple, non-invasive tool that isn't always the first thing that practitioners will go towards, but it's often in conjunction with so many. For a very discrete trauma, like a car accident or an event that they've seen, a very acute trauma, it's incredibly effective. For more chronic and complex traumas, you may have to work with the auricular chromotherapy in conjunction with other aspects. For instance, I did internal family systems training, and I bring that into the treatment protocols often.
If you are fortunate enough to have in your area a practitioner, an existing practitioner who is trained in auricular chromotherapy, perhaps you'd like to look that person up. Not giving medical advice here, just mentioning the availability of a novel kind of treatment that's available. If you do not have somebody who is trained in auricular chromotherapy, and because it is new, a lot of providers are unaware of this therapy, you might want to put them in touch with Sheena, and let's get the information on that. And if you could let them know how best to contact you.
By email is best. So it's Sheena Symington at gmail.com. SHEENASYMINGTON at gmail.com. And also they can go on to theroselab.com, and there's a section in there on auricular chromotherapy with more information.
Now you have one course that still has seats available. I believe that's in October. Is that right?
I have a course in September that has a couple of spots, and then another one in October. So both of them. The September one is 11 to 1 in the afternoon Eastern Standard Time, or 11 a.m. to 1 p.m. Eastern Standard Time, to really accommodate those in Europe and in different time zones. And then in October, it's 7 to 9 p.m. Eastern Standard Time in October. And it's a 12-hour online over 3 weeks.
Okay, so now undergoing this therapy, this light of certain frequency applied to the acupuncture meridian of the ear in the correct spot in the correct way, is that going to unravel your mind or make you crazy or erase memories that you don't want erased? Or what are some of the crazy things that you've heard about as far as concerns with auricular chromotherapy, if any?
I've heard of very little. I've never had a negative response to it, because what you're really doing is you're not doing anything that that person doesn't want to have happen. You get a lot of permission. There's a permission component because, like you say, sometimes it actually does eliminate some of those visual memories. So particularly if it's a lost loved one, or if it's somebody that they perhaps don't want to erase that final time that they've seen them or something, then their brains won't do that, in my opinion. It's a very permission-based therapy. You don't do anything that the person doesn't fully want to do. And it's not me doing anything. It's their brain. It's actually giving them the tools to let this block of energy, setting it down. And it really resolves trauma incredibly quickly. There's like a negative cognition that's kind of stuck with the trauma. And after 3 minutes, it's very much a very positive cognition that, prior to they can't cope whatsoever. And then after the 3 minutes, they're like, I can do this. So it's very, it's unbelievably effective. And that's what I often do too. During the training, there's an experiential piece. So I have practitioners experience the treatment, because that's where the real magic is, because it seems too good to be true. Like you're saying, Keith, it's so almost unbelievable. So you just really make sure of how you set it up, and you get that permission piece, because you're right, we don't want to make anything worse for anyone. And sometimes if somebody has very complex trauma, they need other support modalities to happen in conjunction or prior to auricular chromotherapy. So again, this is for people that are already dealing with trauma, that are already skilled in that area of treatment and holding space. That's so, so incredibly important.
Is there any overlap between uh, what this therapy is designed to do and something like dynamic neural retraining or similar?
Mhm. Mhm. It's a great question. The real beauty I see of this tool is that I have practitioners from all sorts of backgrounds, all sorts of training, all sorts of skill set. So that's exactly what I think. I think this tool can be used in so many different settings. There's a lot of body workers, for example, that have found profound differences in range of motion pre and post treatment. There's that physical component that Dr. Assis really noticed to begin with that is so dependent sometimes on us carrying those emotional traumas with us. And once they're released, our whole body relaxes. So, yeah, and there's been a little bit of research done on it, and that's what I would love to have happen more is some more research that can really document how effective this is in a variety of different situations. I have had some people specifically with auricular chromotherapy and IFS, internal family systems, combined to have dramatic improvements with their electromagnetic radiation syndrome. Absolutely. One example that I'll give you is there was a young man, he wasn't electrosensitive, but he was definitely stuck in flight or fight because at the lab here, we try and measure them pre-treatment to look at how their system is responding. So heart rate variability, just some different parameters so you can document the pre and post treatments. So on the pre-treatment, he was in such flight and fight, his fingers were shaking so much that we actually couldn't get a proper treatment. So after a 3-minute light treatment, he actually had three different traumas. So we did three 3-minute light treatments for three different, very discrete traumas. And one of them was he had a terrible accident as a 10-year-old and had very significant reconstruction of his face. And every time he closed his eyes, it happened at night, he was going down a toboggan hill, he would revisit that trauma. And so he didn't sleep for 10 years. So he came, he was shaking, we couldn't get a reading on it. After those 3-minute light treatments, he was looking really quizzical. And I was like, "Are you okay?" He's like, "I'm not shaking. I'm not shaking." And
Wow.
in his after his treatment, and I asked him, what happened to the image? He said it was gone. Like there was no image. It was just a beautiful ride down the hill. So it was one of the more dramatic, and he was very expressive. So he was like, "Oh my gosh, like what's going on? Like, how is this possible? Like, how do I get this to all my friends?" And the people I was just in this horrible situation with, like, how do I get them the help? So I said, tell your doctors, tell your healthcare providers, I'll train them, I'll teach them how to do this because it's he was carrying so much and so able to set it down. And there's example after example after example.
Wonderful. So, auricular chromotherapy, if you don't have it in your local community, you need to encourage an existing provider to be aware of this course that's being taught. And again, the way that they can get in touch with all of this, their availability. I wasn't aware that you had any remaining this month, but there are a
Hmm.
couple of seats that are still available in September, and it's going to be beginning, I believe, next week.
Yes,
And then
September 9th, 11 a.m.
and then also an opportunity in October. So point them to the Rose Lab. Is it .com? Remind me.
Yes, theroselab.com. Thanks, Keith.
Sheena, thank you so much for all you do with the Electrosensitive Society and for your great work in bringing this training forward.
Thank you. And thanks to Dr. Assis, who developed this incredible method. I feel very privileged to be able to share it.